So the symptoms of hypothyroidism, you have mentioned a good number of them. Okay. Actually, some medicines also cause hypothyroidism. There is a whole other spectrum where the brain has an issue. So if your pituitary gland has a problem, let's say there is a growth on the pituitary gland, it can press on the area that is producing the thyroid stimulating hormone.
Are there tests that can be done to see if your pituitary gland is okay?
So when we just look at the thyroid function tests, if we look at the T3, T4 and the TSH, we can know at least whether this problem is coming from the thyroid gland or the pituitary gland.
Okay.
You see, if your T3, T4 and TSH are all low, then the problem is the pituitary gland.
Do you think that you can get off levothyroxine?
So that's a very interesting question. Now, sometimes you can be having something known as subclinical hypothyroidism. Yeah, so that is a condition whereby your T3 and T4 are normal, but your TSH is high.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
Welcome everybody. My name is Saira Katule. We want to welcome you for another educative session of Anything Thyroid. Today we are honored to have the doctor that we had the last time. So if you've not watched the previous video, I kindly request you to go back, click on the link somewhere down here, watch that video, and then come over here and watch this video. Today we have Dr. Saila Sokwala, and she is going to be doing what we call a Q&A session. So please go grab your cup of tea or something, sit down, and come, let's talk. So, Dr. Sokwalla, welcome back to Health Talk Desk. We are, first of all, happy that you've created the time to be with us. We know you've been very busy. So we want to go through some of the questions that the patients have asked. We are told them, by the way, that the other video really did well. Yes. You have been giving free consultation to so many patients. Some have gotten help. I'm sure some have even reached out to come and see you after that. So that has been wonderful. So today we want to answer some of the questions that they have been sending in. There are quite a number, but some of them I think we handled in the other video. So I'm hoping they will go back to watch that video, guys. But many questions are coming on hypothyroidism. They're saying that we have focused so much on hyperthyroidism that I think hypothyroid patients feel left out. They want to know, how do you manage hypothyroidism in terms of, like, there's somebody that is asking, how do you manage weight gain with hypothyroidism? Another one is asking just general advice on management of hypothyroidism and if it's possible to get off of levothyroxine because of the many symptoms, adding weight, sadness, depression, and all that. So maybe you can tackle that.
Okay.
Yeah.
So hypothyroidism just means low thyroid levels, okay, in the blood. Last time I think we discussed in detail what the thyroid hormone is and what the work of the thyroid hormone in the body is and how it is regulated by the brain through the organ known as the pituitary gland in the brain and how this whole negative feedback loop takes place. So hypothyroidism means when your thyroid levels in the blood, that is the two hormones that we talked about, T3 and T4, are low. Okay? In that case, you have to see what is the cause of that hypothyroidism first when we are looking at management or treatment. And the causes can be many, right? So the most common cause is usually related to an autoimmune condition. We had discussed autoimmunity, whereby your own body's immunity can either destroy the thyroid gland or stimulate the thyroid gland, right? Yeah. When it stimulates or it causes it to function excessively, then that is called Graves' disease, which we discussed, and that's hyperthyroidism. Now we look at hypothyroid is when there is this same type of system whereby you have antibodies, you have got your soldiers of your body are fighting against your own thyroid. So those are called antibodies against the thyroid, and that's known as Hashimoto's thyroiditis. Okay? Causes inflammation of the thyroid and causes destruction of the thyroid gland. Now other causes could be surgical, like patients for any reason, let's say after having thyroid cancer or having a growth in the thyroid gland, or having hyperthyroid. Some patients are removed the thyroid gland as part of their treatment.
Okay.
So that is causes hypothyroidism if a significant portion of the thyroid gland is removed. Okay, and then the other cause could be like radiotherapy to the neck area, causes destruction of the thyroid gland. Not radioiodine therapy, but radiotherapy for cancers, let's say. Radiotherapy is like the high dose radiation given to destroy, let's say the cancer is in the tongue or in the neck area, not necessarily related to the thyroid.
Yes.
It can actually destroy the thyroid gland. So we have patients who come in just post radiotherapy, hypothyroidism. Then you could have, injury to the neck area, and they have to remove the thyroid for any reason if it's bleeding excessively. Or so these are like the non-autoimmune causes. Another cause is iodine deficiency, which luckily in our part of the world, or in Kenya at least, we don't have, because we have got iodized salt. And that was the initiative why the iodized salt came into being as well.
Right.
Part of the reason, right? So iodine is needed for thyroid hormone production. And when you don't have iodine, then you don't have adequate thyroid hormone production. The gland tends to grow bigger, okay, but you have low thyroid levels. So in areas where there is iodine deficiency, the most common cause of low thyroid levels is actually iodine deficiency. Whereas in areas where there is iodine adequacy, like in our part, then the most common cause is autoimmune, Hashimoto's thyroiditis. Yeah. So the symptoms of hypothyroidism, you have mentioned a good number of them. Okay. Actually, some medicines also cause hypothyroidism. Well, even the thyroid, like those patients who have got high thyroid, and then you give anti-thyroid drugs, that can suppress the thyroid hormone itself production. So that can go the other direction. Or high thyroid levels, then you do radioiodine therapy to destroy the thyroid gland. That itself can go the other way to take you towards hypothyroidism. Okay. Some drugs like used for heart diseases. There's some drug known as amiodarone, and we have seen the effects of that drug. It can cause either high levels of thyroid or it can suppress the thyroid levels. So that is another thing to look at, drugs causing hypothyroidism. So when we now go to the symptoms of hypothyroidism, of course weight gain is a prominent symptom. So remember we discussed that when your thyroid level maintains your internal functioning of the body in a balance, right? Including your basal metabolic rate. So what happens is if your thyroid hormone goes high, your basal metabolic rate goes very high, you start losing weight, everything is in fast mode. The opposite is true now. When the thyroid goes low, then everything is in slow mode. So your metabolism is reduced, so you end up gaining weight, okay? You end up having dry skin, you have low moods, depression, like you said, sadness. Okay, some patients even become suicidal if it is very low. And we have seen that, especially after, maybe complete thyroid removal, surgeries, or after cancer, when you're doing cancer treatment and then you have to keep the patient off thyroxine because you want to give radioiodine therapy. So that time the levels go very low, and that can cause significant psychological issues. So depression is one of them. You could also get hair loss, hair thinning and hair loss, okay? You could get menstrual irregularities in women. They get irregular menses. Blood pressure can go high as well. So high blood pressure is another of the symptoms. So these are some of the symptoms of hypothyroidism. And of course, the problem is now reversing that, right? So treatment of hypothyroidism depends, like I said, on the cause. Why did I say that? Again, one aspect of hypothyroidism that I have not even mentioned is that's all related to the thyroid causes that we talked about. There is a whole other spectrum where the brain has an issue. So if your pituitary gland has a problem, let's say there is a growth on the pituitary gland, it can press on the area that is producing the thyroid stimulating hormone, which causes the thyroid gland to produce its hormones. So that itself can, or when the pituitary gland is removed, or again when there is radiotherapy to the pituitary gland, then your levels of thyroxine will go low, like T3 and T4 will still go low because there is no stimulus coming from the brain. Okay. Yep. So when we look at the treatment, right? That's what your concern is. So when you
Yeah, that's what patients are asking about, like the management of hypothyroidism. But I'm happy you've mentioned about the pituitary disease, because I think I'm having more patients coming in. Some have even have to go brain surgery for the pituitary gland, but most of them are quiet because a lot of the doctors are not able to link hypothyroidism to pituitary disease. So some patients are, and you find that because they are not able to, so then now the patient gets frustrated and the journey becomes longer. Do you think, in your opinion, that it would be good to actually, or what would you advise? Even when you're trying to diagnose the whole aspect of thyroid disease and hypothyroidism, are there tests that can be done to see if your pituitary gland is okay?
So when we just look at the thyroid function tests, if we look at the T3, T4 and the TSH, we can know at least whether this problem is coming from the thyroid gland or the pituitary gland.
Okay.
You see, if your T3, T4 and TSH are all low, then the problem is the pituitary gland.
Oh,
right?
Okay.
But if your T3, T4 are low and your TSH is high, because that means the pituitary is trying to to stimulate the thyroid to produce more hormone, then your TSH will be high, but your T3, T4 will be low. So it kind of gives us a clue where the problem is. Is it the thyroid gland or the pituitary gland? Of course, the patient's history is also very important. We have to look at the other features. If you've got a big tumor sitting in the pituitary gland, it would cause other effects as well. Your patients could have high, levels of prolactin, for example, another hormone. There could be issues related to headaches, visual problems. So those are some of the clues that tells us that the problem may not only be the thyroid gland, maybe the issues in the pituitary.
Okay.
Yeah.
Do you think that you can get off levothyroxine?
So that's a very interesting question. It really depends on the cause again. So you see, if the cause is just like a temporary one, like if you had a thyroid inflammation, let's say thyroiditis, if you got inflammation in the thyroid gland, that can cause your levels of the thyroid hormones to go high, then drop down and then normalize. So that is one of the cases where you can actually get out of levothyroxine after your thyroid level is normalized. So if the cause is a temporary cause compared to if it's a permanent cause, that will determine how much of levothyroxine you need. Now sometimes you can be having something known as subclinical hypothyroidism. Yeah, so that is a condition whereby your T3 and T4 are normal, but your TSH is high. Okay, at times that corrects itself and we can try, if the patient was on a very low dose thyroxine, to try and remove. Like elderly people who do not need so much of thyroid hormone in their blood, and if their thyroid level is okay but the TSH is high, sometimes we don't treat that with thyroxine. We can try to get out of it after a certain age. Let's say 70 years of age, the patient is not mobile. They're of course not expected to be pregnant. They're not, so then in that case you balance out and see if you can come out. But on your own, you should never come out of thyroxine. So you should do it in relation or in consultation with the doctor. It's not very easy to come out of thyroxine once you are, like, in the sense that if you are required to take it. Like in the cases of autoimmune thyroid disease, it's a bit unlikely that you'll totally come out of thyroxine once you have required it and you have started. That means there was a problem in your body and the thyroid level destruction has come to that level that you need to probably be on the thyroxine. Now there are times when your requirement of thyroxine goes higher than what you are taking. So patients, like let's say they're taking 100 micrograms, may end up requiring even all the way up to 150, 200, like in case of pregnancy. Where your baby requires thyroxine to it. By the time the baby's thyroid gland starts to work, it's at least 15, 16 weeks. So the baby requires the mother's thyroxine to work, to function for their brain development. So then we increase the doses. So the doses might even be increased significantly and then brought down. So that's one case where you can be on a higher dose and after pregnancy your requirement goes down. So you reduce the dose, but it usually doesn't go to complete zero. Unless you started with a subclinical hypothyroidism, And then in pregnancy, you required a low dose, and then now you're getting off it again. Do you get me?
No.
Yeah, so the point of removing levothyroxine once you've started, that's what the question is,
Yes,
right?
yeah.
So let us say that we had a patient, a female, whose level of thyroid hormone was normal before pregnancy. But they did the thyroid level in pregnancy because the requirement is higher in pregnancy, or the level was probably borderline before pregnancy. And then in pregnancy, because the requirement is higher and their thyroid cannot match up, the levels drop down because the baby is removing the thyroid hormone. So if the levels drop down, you'll give thyroxine, right?
Okay.
Because the levels in pregnancy even are different. The target is different. You need to have a higher level of thyroid hormone compared to if you're not pregnant.
Okay.
So you give higher doses, but then after delivery, you can still go back down.
Okay.
You see if the levels normalize.
Yeah.
So that's one situation where you might be able to like come out of it, but after initiating it. But most of the times you would require to continue it for long term. Okay? Now we have a recent study. Actually, a lot of studies have been done, but now we have got what we call as a meta-analysis, a very big study to look at like combining all the studies to see there is this micro element or micronutrient known as selenium. So there is the role of selenium in autoimmune hypothyroidism or Hashimoto's thyroiditis, and it has shown to improve the thyroid function or restore it for longer.
Yeah.
So it doesn't mean that you'll remove your thyroxine and give it, but it's something that helps with thyroid health when you have autoimmune specifically, not other forms of hypothyroidism.
Oh,
Yeah.
Okay. That's good. Okay, we've handled that one for how to get off levothyroxine. Somebody says they did a total thyroidectomy, so that means they went hypo. But before, their monthly period was missing. It wasn't as, what do you call it? It was not
Regular.
as regular, yes. Will they come back to normal? Will they be regular again?
As long as the thyroid hormone is stabilized, and if that was the cause of the low, you're saying someone who had
Yeah, they did a total thyroidectomy.
because of what?
Okay, she's
That's
not
the thing. So
specific.
anyway, after the thyroid is removed, depending on what it was like before, like if it was overproducing, it will mess your menses, right? It could mess your menstrual cycle if it is not well controlled. So if it was overproducing and there were issues with the menstrual cycle because of the hyperthyroidism, and you remove the thyroid gland, it is possible that it will normalize as long as you make sure that the thyroid level is within normal
range.
Means that if the patient is requiring thyroxine, then they have to be on thyroxine and make sure that the level is normal. Then you can say if the level is normal and your periods are still not regular, that means probably it wasn't the thyroid issue that was causing the irregular menses. There are 101 reasons why your periods can be irregular.
Yeah. Okay. And does hypothyroidism cause joint pain, elbow pain, facial hair?
It can actually. So it is possible that with excessive weight gain, you can get those issues first thing. Secondly, another thing that you have to look at is if it is autoimmune. If it is autoimmune thyroiditis, like if it is Hashimoto's, it can come with other autoimmune conditions.
Okay.
So if you're having joint pains, it's good to check for rheumatoid arthritis, which is a joint condition which is autoimmune
Okay. Yeah.
as well.
Yeah.
Or there's another one called SLE, which causes skin rashes and also can be associated with joint pains. So then that's something that needs to be also assessed. It can even be associated with diabetes, type 1 diabetes, where you have autoimmune destruction of the pancreas. So autoimmune conditions tend to come together. So if you've got other symptoms, you need to assess for that as well. Yeah.
Okay. So let's talk about diet lifestyle. Somebody is asking to try and manage weight. Can they do intermittent fasting?
Yes, they can. There's no contraindication to that.
Yes, you can. Yes, you can.
So weight gain is a very significant common problem with hypothyroidism. And the problem is that this weight gain is not only fat, there's also fluid.
Yes.
You see, and tissue under the skin, yeah? So it's not only weight gain due to just fat
Yeah,
weight,
yeah,
and it's not very easy to lose weight with hypothyroidism, and that's true.
I'm really glad you said
Yeah.
that, because I think that also helps to change the patient's approach on how they choose to reduce weight gain.
Yes.
But what would you advise for a patient to lose weight?
To lose, in fact, generally anybody with significant weight gain, we have to check the thyroid first of all.
Mm-hmm.
That's the first test I ask for. It's that commonly associated with weight gain, right?
Mm-hmm.
So of course, first thing is it takes time for your metabolism to come back to normal, even if your thyroid levels have normalized.
Yeah.
So sometimes what happens is, the first step is to make sure that your thyroid level is normal, right?
Okay.
Within target ranges.
Mm-hmm.
Sometimes we even take it to upper half of normal, the T4 levels, to the upper half of normal to make sure it is okay and that the symptoms are improving otherwise. If that is not helping, we may even add T3. If basically the T3 level is low, it's not common to treat with T3. But certain selected cases we do as endocrinologists decide, okay, this is a patient who may benefit from adding T3 to the T4. With the treatment we give that levothyroxine or the brands that are available in the market is T4 usually, okay? So T3 is not commonly given and it's not even very widely available, but it is there, okay? So we do give to certain select patients if we see they are not improving or the T3 is persistently on the lower side. Anyway, once your thyroid level is normalized, now concurrently you need to also implement good lifestyles. Okay, so intermittent fasting is a good option as long as it's sustainable. The problem is most of these diets is sustainability. But if you just understand what is good eating, like healthy eating overall, and balance your meals and reduce on your carbs, in the diets, reduce on the high fat content meals, and reduce processed. Most important is going natural.
Yeah.
Remember, with especially with Hashimoto's, you need to also look at your consumption of certain foods like they're called goitrogens. We are talking about broccoli, cauliflower, cabbage, yeah? So those ones, in as much as they're quite healthy otherwise, but with Hashimoto's, we want to reduce the consumption of those foods.
Yeah. You reduce.
So that's you don't stop cooking.
You don't stop.
You reduce the consumption. Okay?
Yes. Yeah.
So healthy lifestyle obviously plays a very big role. When you have hypothyroidism, you don't even want to walk. You don't even want to exercise. You don't want to. Your motivation levels are also very low. So first thing is, as long as you stabilize the thyroid hormone levels, now you bring in that aspect of the motivation to work out, motivation to change your diets, and then you work on the aspect of healthy lifestyles or healthy living, and it's a journey. It's not going to be easy to lose weight with hypothyroidism. I'll be very honest. We have really big challenges with weight loss. So what we do at times is we give you the lifestyle modification options and give it time. We tell the patient we'll give you 6 months of this, 3 to 6 months. If it's not working, then we go to option B, where we may want to introduce some medical therapy to help with that weight loss. If that is not helping, then we go to, typically like with any other case of morbid or excessive weight, obesity.
Yeah. Okay. That's good. Does thyroid disease or hypothyroidism cause neck pain?
Ideally, it should not, if it's just hypothyroidism. But if you have a big nodule or, sometimes there's this multinodular goiters also can cause your levels to go down. If they're quite big and they're causing pressure on the surrounding structures, they can cause pain. But hypothyroidism per se on its own should not cause neck pain. Unless, it's not the hypothyroidism, but after surgery you've got neck pain. That's because of the surgery. But alone on its own, it shouldn't cause neck pain as such. Unless it's, Hashimoto's and there's significant inflammation, but very rare.
So for those that suffer from neck pain but have a
they should get evaluated.
Yeah, because there's more to it.
There is definitely more. There could be a nodule which has blood in it or infection in it.
Yeah.
So that should be evaluated to see why.
Yeah. Okay, someone is saying after a partial thyroidectomy last year, she got poor eyesight. She's sweating excessively. She has discomfort around the neck, so pain, and she's getting breathless after doing some manual work. And she still on carbimazole?
That one should come and see me definitely.
Come and see Dr.
Because I
Sokwalla
need to
for
see
that.
the thyroid hormone levels. I want to see the ultrasound.
Okay,
Why
please
was a
consult.
partial thyroidectomy done? What was the underlying cause?
Yes, true.
There's a lot more here
than meets the eye.
than just a simple partial thyroid. Maybe after the thyroid surgery, there was something that happened.
Yeah.
I really cannot comment on that.
Okay.
Sorry, but that one, it would be very good
See
if
a
I can
specialist.
if I can see a specialist, it would help
It would
definitely.
help.
Yeah.
I hope that you're enjoying the session. We'll take a short break. We'll be right back after this. Stay tuned.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
Welcome back, everybody. I hope that you're learning from our today's session. We continue with the Q&A session where Dr. Sokwalla is answering some of the questions that you sent in. So, Dr. Sokwalla, we have a few questions about RAI therapy treatment. Somebody is saying that after RAI treatment, which of course induced hypothyroidism, do you just assume that the radioactive iodine has gotten off the system and now can you go back to normal? Or what can you advise patients that have undergone RAI in terms of getting pregnant, going back to their normal menses and stuff? Yeah.
So it really, you see, radioactive iodine is a therapy which is used for mainly two indications. So one of them is if you've got hyperthyroidism, if you've got excessive thyroid hormone in the body, which is being produced by the thyroid gland, excessively produced, right? Either Graves' disease or it could be a nodule or multiple nodules. It's one of the therapy for that.
Okay.
And that is a low dose radioactive iodine. Okay? So radioactive iodine is not the same as radiotherapy. It's important to understand that. So radioactive iodine does not increase your risk of cancers, at least not from the studies that we have. And high dose radioactive iodine therapy is usually given for thyroid cancers. So after treatment of thyroid cancer surgically, usually, the follow-up, depending on the extent of the tumor, is with this radioactive iodine. It's usually in the form of either a capsule or a liquid that's swallowed, and it destroys the thyroid gland. Okay? Because it's iodine, it chooses to go to the thyroid gland and causes destruction there. So some of the things that we have to know about radioactive iodine is preparation for it, first of all. So if the patients are on drugs for thyroid disease, then we usually, not thyroxine, but if they are on medicines for thyroid disease, reduction like carbimazole or propylthiouracil, then that needs to be stopped a few days before. Again, even thyroxine, depending on why you are doing it, like for cancer treatment, we usually stop thyroxine as well, and make sure that the levels of your TSH is high, so that the uptake of the radioactive iodine is high. Okay, so that's one thing in the preparation. Then during, it's just like I said, a capsule or liquid, that depending on where you are doing it. After, now that's where we have to be a bit precautious. So when you're doing it for Graves' disease, like I said, or hyperthyroidism, the dose is small. Maximum of 3 days you need to keep away from people. Usually then you can carry on with your life. But generally we do not recommend pregnancy within at least 6 months of radioactive iodine, no matter what reason you got it for, because it can still go to the baby, right? So that's one thing that we have to take care of. At least for 6 months after any form of radioactive iodine, you cannot conceive. You should be on contraceptives, okay, depending on what contraceptive suits the woman, right? After high dose radioiodine, sometimes they are told to stay away from, depending on now again the dose, to stay in isolation for about a week, usually, yeah? Okay. And then after that, they are started on thyroxine. One thing, of course, to look out for, as you said, is hypothyroidism, okay? Which it takes some time to completely stabilize. It can take even up to 2-3 months to now know how much low your thyroid has gone. But usually within at least a month, we can start and like realizing that it's going low, right? So when you're giving low dose, it can just normalize the thyroid hormone if you have Graves' disease or hyperthyroidism. You know, but if you are giving it for cancer, the reason you are giving it is to destroy
the whole thyroid gland,
any thyroid tissue anywhere. Because if your cancer is responsive to radioactive iodine, That's why it is used, so that even if it has spread, it will go and destroy the thyroid gland anywhere it may be in the body, right?
Okay.
Yeah.
So for the one that is not treating thyroid cancer, so how is the impact? What exactly happens then? So that means it doesn't really destroy the whole.
It does destroy the thyroid, but it doesn't destroy like 100% of the thyroid tissue that is there. It's not aimed to do that. It is aimed to reduce your thyroid. Why you are giving it is to reduce your thyroid hormone production to normal levels.
So it just kills certain number
It's
of
supposed to
tissues.
kill a certain number of the thyroid cells, right?
Okay.
Which are overproducing. That's why you are keeping away medicine so that you get the thyroid gland to overproduce.
Mm-hmm.
And then so you can't give it when the thyroid levels are very high because that is dangerous, right?
Yeah.
Because it causes destruction of the thyroid tissues, can release thyroid hormone into the circulation. So first we normalize the thyroid hormone levels as close to normal as possible, and then we stop the thyroid medicine, and then after about 4-5 days you give the radioactive iodine, so that it goes to those areas which are overproducing. When iodine is seen by the thyroid and it is overproducing, it will take it up and try to overproduce.
Okay. Yes.
But if it is in high doses, it actually inhibits or stops the production, and it can cause destruction of the thyroid gland, right? So it's ideally supposed to normalize the thyroid levels. That's why you're giving it in hyperthyroidism. But sometimes, like in about over a third of cases, actually 1/3 to 2/3, depending on where you are, it can actually cause significant destruction to the level that you now thyroid hormone production goes very low, and you need thyroxine supplementation. But that was not the aim to completely destroy the thyroid. That's the side effect of radioactive iodine. You get me?
Okay, yes, I've understood that. Okay, let's shift into diet a little bit and talk about gluten and its impact on hypothyroidism, especially hypothyroidism.
Yes.
Yeah.
So there's a lot of questions we get asked. Do we stop eating gluten-containing diet when we have got hypothyroidism? So the truth is, gluten is immunogenic in the sense that gluten can cause inflammation in patients who have got a high tendency for inflammation. Okay? So autoimmune conditions usually tend to occur together. We said that already. So there is one other autoimmune condition which is known as celiac sprue. It means your body cannot tolerate gluten. Okay? And any amount of gluten will flare up the immunogenicity or immunity in your stomach. So it is where your stomach cannot tolerate, let's say the stomach and intestines cannot tolerate gluten. Okay, your chapati that you eat, if you've got gluten intolerance, you start having bloating, you may even have diarrhea.
Yeah.
And that's very uncomfortable for patients. So not everyone should be on a gluten-free diet, but if you've got Hashimoto's thyroiditis, then you have to look for glutens or celiac sprue. And for patients who do have that, then we definitely tell them to keep away from gluten, because that helps not only the symptoms of celiac sprue, but also reduces the immunogenicity for the thyroid, because there is cross-reactivity of the antibodies as well. So those are the patients that we would ideally recommend to keep off of gluten.
Okay, so that you can have that test done for getting.
Yes, there's a test to be done, and the test has to be done while you are taking your chapatis, right? While you are taking your gluten.
So
that's the blood test, and their blood test. So you can get the test done. It's a assessment of the antibodies. Now the way we are checking for antibodies to thyroid, these are antibodies to that intestinal part where the inflammation happens.
Oh, okay. So you have to eat some bread in the morning and then go have your
test done.
Gluten test. Okay. Somebody is asking if the thyroid function tests are normal, but symptoms still remain high or low. Like for example, you can have high heart rate. I think this one is a hyperthyroid question. High heart rate, anxiety, insomnia. What could be the problem? It could be just that. It could be anxiety, right? Yeah. So it's there are multiple things that it could be, right? So I have had cases whereby the patient has got hyperthyroidism, typical classic Graves, okay? And then we bring down the levels and we give all the kind of medication that we can give. We give carbimazole, we give propranolol,
and we try and bring the heart rate down, but her heart rate just refused to go down.
Yeah. And
So-
how many that?
And then insomnia as well, typically the symptoms you're talking about, yeah?
Yeah.
So what we realized is that there were two other problems that she was going through. One was anxiety. Anxiety as a diagnosis. Anxiety itself is a diagnosis.
That's
It's
a very
known as
good
generalized
answer.
anxiety disorder. So she did have anxiety because we got psychiatric evaluation and she qualified all the criteria for anxiety. Secondly, she also, on top of that, had a heart problem inherently. Due to the high thyroid over a long period of time, it actually had caused her structural problem inside her heart. Okay, and that was causing her heart rate to continuously remain high. We got the cardiologist involved. We changed her heart medicine from propranolol to another one which would help rate control with the heart, and we handled the heart disease. Yeah, so basically, thyroid overfunctioning over a long period of time can affect the heart structurally on its own.
So define long.
Okay.
Define the long period of time.
So, like for her, actually, it was a year.
A year.
Over 1 year, less than a year actually. And so it really depends on your underlying heart problem as well. So
Okay.
if you have an underlying structural heart problem and you get hyperthyroidism, it's augmented. You know, thyroid hormone can cause irregular heart rate as well. So even after you treat the thyroid hormone levels, the structural changes that could have happened in your heart will still probably
Be
lead
there,
to that
okay.
high heart rate and heart rate irregularity, you see.
Okay.
So it can cause a structural problem in your heart. That's what I'm saying, over a prolonged period of time if you remain in that hyperthyroid state.
Okay. Last question, but this is the last question. She says she had a partial thyroidectomy years ago for a big goiter that she had, but she was never put on medication. Now she's experiencing chronic fatigue and other unpleasant symptoms, but the tests are showing normal thyroid levels. So then she was later diagnosed with fibromyalgia.
Exactly, yeah.
So is there a possibility that the thyroid could be causing some of these issues?
A bit unlikely if the thyroid hormones are normal.
So
Yeah.
it's a totally different.
Let me tell you one thing that our viewers need to understand, and probably we need to be very clear about, is that thyroid hormone disorders can cause symptoms which can mimic a lot of other things, or a lot of other conditions can mimic problems of the thyroid.
Okay.
You know, you can
Yeah.
have, like I said, anxiety. Anxiety has palpitations, anxiety has excessive sweating sometimes, you
Yeah.
have insomnia. Classical symptoms of hyperthyroidism. You will not eat food because you're not feeling hungry. You know, when you're just anxious all the time, so you lose weight, so you start thinking that clearly these are thyroid related symptoms.
Yeah.
But this, so basically she has fibromyalgia, she has said it herself.
Yeah.
So the thyroid removal and normal levels tell you that probably her issue is not due to
Just
the thyroid,
thyroid, yes.
and the remaining thyroid hormone has taken up its function.
Mm.
Yeah? So probably the rest of the symptoms are due to that fibromyalgia or something else. So when the symptoms persist after we have handled the thyroid and caused it to get into normal, or rather brought it to normal levels, then we always have to think about other conditions that could be underlying or associated with it, you know.
Okay. Okay. Actually, that answers the next question. So I think we are done for that. Dr. What would you be your last word maybe for our viewers as we wind up?
Yeah.
And then you can even tell them where to come and find you in
Yes.
case some of them want to come and use your
Yeah.
services.
So I think one thing that from the last discussion that we just had is to basically understand that thyroid problems can mimic other diseases, and you have to look for everything else along with the thyroid if you are treating, especially if your thyroid levels are within normal ranges. So for all patients who are seeking psychiatric care for anxiety, depression, mood disorders, it is mandatory actually to do thyroid function tests and rule out any problems with the thyroid. If you're having menstrual irregularities, if you're having fertility problems, then if you're having chronic fatigue, okay, anxiety, then you need to get your thyroid levels checked to rule out any problems with either high thyroid or low thyroid levels. However, if the levels are normal and you don't have any other reason to suspect a thyroid disease being the reason for this, then you need to get other tests done to rule out other conditions like in the case of fibromyalgia which is quite common as well. So that is what I'd like to say. I am located at the Aga Khan University Hospital, Nairobi. And there's some booking details I think we can share with you in case anybody wants to book an appointment with me. Yes, so I'm on 6th floor East Tower block at the Aga Khan University Hospital, Nairobi.
Okay. Thank you very much for joining us for today's session. Of course, we want to appreciate Dr. Sokwalla very, very much for taking her time to come and be with us today here at Health Talk Desk. She's left her details. We'll also link her details on the description box. If you've not liked and subscribed, hey, please do that, because when you subscribe, you're also helping this video to spread, and somebody might actually get help simply because you did that. Okay, please join us for the next video, and we'll see you then. My name is Saira Katule. Bye-bye for now.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.